program where we prepare meals and activities for the seniors of this community. And Boriken Health Center has a major project in front of us, and that is to build the first completely green community health center in the city and state of New York. And with that said, I would like to welcome Reverend Al Sharpton to the East Harlem Council Boriken Health Center. And I want to say Mr. Sharpton is the president of the National Action Network and one of the country's leading civil rights advocates. He is tireless in his work around equal access to healthcare, education, and reform. And I can't begin to tell you how proud we are here in this family to have him here with us today. Mr. Sharpton, and by the way, this is the first time I've said his name right.
Well, thank you. First of all, let me say I'm happy and honored to be here today. But not just to visit, but to say that as the members of Congress and the Senate go to meet with the President, it is health facilities like this that must be maintained and part of any health care package. I support health care legislation, but we must also make sure that those that are disproportionately impacted are not left out of the legislation. It is imperative that we understand that what is happening on the ground is as important as all of the cerebral debates. And the service that this center gives every day is a matter of life and death for people in East Harlem and the East Harlems around the country. We must make sure this legislation, as much as we support it, supports those efforts like these community centers that risk every day the lack of resources and the lack of support. So I'm proud to stand with former Congressman J.C. Watts in raising a question of inequality. He and I may not agree on every item, on every issue, but we agree that we cannot have health care reform and leave some Americans default. Amen. So just as we reached across party lines to deal with education reform with Newt Gingrich, we can reach across party lines to stand together for making sure that all are included in health care reform. Because if all are not included, then we have not truly reformed health care. And I might say reaching over and standing with J.C. Watts was a lot easier than standing with Newt Gingrich. Mr. Watts. I didn't know the order. You know how disruptive us Democrats can be.
Good morning. I'm Gary Pucker. I'm the president of the National Minority Quality Forum. We're a nonprofit organization based in Washington, D.C. Excited to be here at the Boriken Health Center. We've traveled around a lot of health centers around the country. They're a vital part of the American infrastructure, providing safety nets for millions and millions of Americans. So I'm actually very, very pleased to be here. I'm also obviously pleased to be here with Reverend Sharpton. His work and his voice in healthcare has been a very, very important voice, and Congressman J.C. Watts. Congressman Watts has done some amazing things. There's a study that was done back in the 1980s that really moved the whole discussion around health disparities, and Congressman Watts was one of the pushers of that study back in the 1980s. I'm here to tell you that there's an important change happening in America. By the year 2020, 40% of the American population is going to be minority. By 2043, 50% of Americans are going to be African American, Hispanic, Asian, Native American. This emerging majority, its health care is not part of the priority. If you go look at that legislation, what you're going to see is that it's really about something happening in the 20th century. It is not built for the 21st century, for a diverse America. And so what we want to see is some focus on the emerging majority. There's a new population that is going to be America's workforce, that's going to be America's military force, and what we're urging is really a new look at that legislation and have it really built for 21st century America. Congressman Watts understood this a long time ago. His work in the House and his work out of the House has been about that. He has reached across the aisle before with Congresswoman Donna Christensen, who did a powerful work in Washington around helping the reform and others. So I'm really excited to be standing with him today and look forward to working with him and Reverend Sharpton.
I am delighted to be here, and Reverend Sharpton and Dr. Tuckering and I are delighted, Ellie, that you would open your doors to us today and give us an opportunity to invade and intrude and kind of get an opportunity to be in a facility and see up close and personal what you all do and how you do it and the results that you get in doing it. I am delighted to be with Reverend Sharpton, who obviously has been on the front line on many issues. And it's not hard to, if you're channel surfer the way I am, it's not hard to be looking at some news channel and not hard or surprising to see Reverend Sharpton on there stating his thoughts and ideas on not just education, but health care, social justice, or policy, or international policy. So you know that whenever you see Reverend Sharpton, it's going to be insightful, informative, and he's never had any bashfulness about stating his thoughts and opinions on any issue. So I'm delighted to stand with him today on minority health care disparities. Dr. Gary Puckering is the director of the Minority Quality Forum. So he too has been in the trenches, just like Reverend Sharpton, on this issue for many years. He gets up every single day thinking about the issues that Ellie deals with here at the center, and we appreciate his work. We are in a national discussion, which I think is a good thing, concerning health care